The treatment session starts with an assessment of muscle function by conducting an evaluation to identify muscles that are not functioning properly, creating muscle imbalances and compensation patterns that over time can result in pain. So the practitioner will identify what is an elephant, or as you see in here, a range of motion that maybe is not equal bilaterally. So now we will address that hip external rotation that we see is not equal bilaterally, and we'll move on to the next step, which is correction of muscle inhibition. So by addressing these muscles, proper communication between the nervous system and muscular system is established, enhancing muscle contractile capabilities and restoring muscle function. As you see, we are testing muscles as we go through, and we're trying to identify ones that aren't quite turned on, like this one, this glute muscle. And so we will then work through and try to activate these muscles to try to get them firing. One way to restore the muscle function is by providing a force with our digits to the tendons to try to send a signal to the brain to try to get this muscle firing. And then another way that we could also get these muscles firing, besides the way we've done with these two glute muscles, is that we will use some isometric activities to try to get them firing. So in this one, we see that it's not working properly. So then instead of doing a normal palpation to try to get those muscles firing, we're going to use some isometrics to get this muscle firing in this session. Isometrics can look a little different depending on what's needed and what works best for the client, but in this one we're doing 6-second hold 6 times in the testing position to try to get that very specific muscle firing in the position we need it firing. We will continue testing all the muscles that we need to, depending on what area we're trying to work on, and we will find which ones need to be turned on, turn those on and keep moving, and then this leads to restoration of the range of motion, so the body can gain stability and increase mobility through these targeted techniques that systematically reactivate muscles that have become inhibited due to stress, trauma, and overuse. And then once we feel that we've gone through this, done all the things we can, we'll go back through and recheck all the range of motion tests to ensure that we have had an impact during the session. So as you see